Now, let's go back to our earlier interview now. KwaZulu-Natal is the province with the highest HIV prevalence in the country, according to the latest stats from the Human Sciences Research Council report. The HSRC, in collaboration with its partners, has announced key findings from the 6th South African National HIV Prevalence, Incidence and Behaviour Survey. The country is known to have the world's largest HIV epidemic. Now, let's discuss this further. We're now joined via Teams by Dr Thembisile Xulu. She's the CEO of the South African National AIDS Council. Dr. Xulu, thank you so much for your time this afternoon. Now, just give us some top-level key findings of this report, particularly in terms of the progress that has been made, since the last report in ending HIV in South Africa.
Thank you so much, Onati, and good afternoon to your viewers. We are seeing a decline in terms of the number of people that are living with HIV in the country. There's a decline in prevalence by about 1.3%. And I think this speaks very much to the success of the treatment program, because people that are on treatment are not transmitting virus. So we are not seeing as many new infections, even though the focus on this report was not on the incidence. But we are actually seeing some of the benefits of expanding our treatment program. We are also seeing very stark differences in prevalence by sex. So males versus females. Females have highest prevalence between the ages of 35 to 39, whereas for males, highest prevalence is between the ages of 45 to 49. When it comes to viral suppression data, we are also seeing concerning differences in terms of males and females. Generally, females tend to do better in terms of adherence to treatment than men, but we are seeing in this study that younger females are not as adherent to treatment as their male counterparts. And this is quite concerning when you look at the fact that when we look at the age group 15 to 19, as well as 20 to 24, HIV is 2 times higher in females than in males. And then when we get to the age group of 25 to 29, it's actually 3 times higher in females than in males. We've certainly seen an expansion of prevention with 50% of males being circumcised medically. And as much as KwaZulu-Natal does have the highest prevalence, we are also seeing treatment successes with the highest level of viral suppression being reported in the province of KwaZulu-Natal. So overall, a great progress, but we still have a lot to do, especially in terms of attending to key and priority populations, as well as how stubborn the vulnerability of women and girls is, and how we need to be tailoring effective interventions for those population groups.
And I want us to talk about that. As the AIDS Council, one of your mandates is surely to evaluate, policy implementation in the country, taking into account the gaps that you're talking about and considering where we are at the moment. I mean, do you think that government and other stakeholders like yourselves should do more, or are failing when you consider that HIV infections in children are still so prevalent? I mean, earlier this year, we heard how in KwaZulu-Natal alone, it remains the leading province in the spread of HIV and AIDS because of older HIV-positive men who take advantage of young girls. And of course, the fact that the impact of HIV epidemic is unequal across geographic regions and populations. So in the Western Cape, for example, you get lower numbers than you would, for instance, in KZN, as I mentioned.
Thanks, Onati. So I think from SANAC's side, led by the presidency, it's very clear that it can't just be a health response. So our role as SANAC is to make sure that all stakeholders are coming to the table and pulling towards one direction. We are very clear, as you say, the data informs us that young girls are being infected by older men. So the strategies have to, one, be focused on the young girls around empowering them with information, empowering them in terms of economic opportunities, in order to deal with the disparities that make them so much more vulnerable. But at the same time, the strategies that are targeted towards men actually have to strengthen the men around their awareness, expose them to prevention interventions like PrEP, bring back the importance of barrier interventions like condoms, because as you can see, we are seeing a shift in terms of older males actually being infected. So it's a multi-sectoral response that this data is helping to inform. But when you look, for instance, at the fact that just over the last 2 weekends, the Deputy President, who is the chair of SANAC, launched 2 activities. One being a men's program of action, where men are standing up and saying they know that gender-based violence contributes to new HIV infections and other social ills. And these are part of the strategies that not only address men's issues, but also address issues related to young women and girls. And this last Saturday, the Deputy President launched the 16 days of activism against the abuse of women and children. And these, I would say, are the enablers that we need to make sure that we address the cross-cutting societal vulnerabilities, particularly of women, children, and young girls.
And my question was going to, to say, Dr. Xulu, to what extent does poverty deepen the crisis or exacerbate it that we are currently seeing in as far as HIV prevention is concerned? I mean, you look and you read at so many devastating stories of just recently in a television program, an HIV-positive mother in the Eastern Cape opting rather to breastfeed her daughter who is HIV negative because of the poverty crisis in the Eastern Cape. To what extent then do these reports help in as far as galvanizing other departments to help out, particularly where we speak about, child support and other gaps that are there in terms of, just helping those that are living under extreme poverty conditions?
So these particular reports are quite important and have guided, for instance, a program that South Africa is launching, led by the United Nations, called the Global Alliance to End AIDS in Children by 2030, because there are very clear interlinkages between poverty, HIV, TB, gender-based violence, and other human rights violations. And when we look, for instance, at the data for children, we are seeing that children are being left behind. So from our end, for instance, as SANAC, we are leading together with the Department of Basic Education because there is the whole school health program focused on children, but the Department of Social Development is the custodian for children. And together with the Department of Health, we are addressing health issues, but making sure that the health response is embedded in the social response, because these mothers that have got are people living with HIV that need treatment are actually poor. They are the ones that are unemployed. And if we respond with just biomedical means, it doesn't take care of the bigger social issues. Hence, it's a multi-sectoral partnership led by the 3 departments, as I've mentioned, and addressing the whole of government, whole of society response in order to respond and make sure that we improve the general socio-economic status of South Africans and not just respond medically.
Dr. Xulu, thank you so much for your time this afternoon. Really do appreciate it. Dr. Thembisile Xulu is the CEO of the South African National AIDS Council, of course, commenting there about the latest report to come out of the Human Sciences Research Council, which says that HIV in South Africa has decreased from 14% in 2017 to 12.7% in 2022.